Swadika, I'm Sochin Limgrengai and welcome to Be My Guest, the program that brings you successful stories of institutions and entrepreneurs in both the domestic and international arena. As we all know that in Thailand, road accidents is a major problem that causes a lot of death each year, and especially during the festival where there is a higher number of accidents. In today's episode, we will be talking with the Thai Health Promotion Foundation about how they are coming up with campaigns and promotions to help prevent this accident. So let's find out more with our guest today. In today's episode, we are joined by Ms. Tassani Silapabut, the Plan Executive Committee of the Thai Health Promotion Foundation. Sawadika.
Sawadika.
Thank you for joining us today. First of all, let me ask you to explain to us the responsibilities and the roles of the Thai Health Promotion Foundation.
Yes. Thai Health Promotion Foundation, that we call in Thai Health or SOSOSO, was established in 2001.
Okay.
And the first organized of its kind in Asia.
I see.
Yeah. Created under the Health Promotion Foundation Act 2001. Thai Health is an autonomous state agency.
Okay.
Yes, outside of the formal state governments. It is founded by Syntax. Have you ever heard?
Yeah.
From the alcohol and tobacco.
I see.
Yes. It has annual budget about 90 and 80 million US dollars.
Okay, so that's a large sum.
Yes, it's a large. It is, which is spent on the health promotion activities.
I see.
Yes. It has a government board chaired by the Prime Minister.
Okay.
With half of its member from the outside of the independent social organization. Thai Health emphasize health public campaigns and policy issue-based project and holistic approach.
I see.
Thai Health acts as a catalyst for project.
Okay.
The change value, lifestyle, and social development directed to positive change.
Okay.
Yeah, that we intend to do.
So for like health promotion kind of campaigns that you're trying to work on.
Right.
I see.
Yes. We have the philosophy of Thai health.
Okay.
That is very, very lovely. All Thais can attain better life. It's very beautiful.
And it's very true, actually.
Yes. And it is self-reliant ways to, by increase the cooperation is very important.
Yes.
Thai Health target its activity at the social determinants of health. As you mentioned earlier about the road safety or traffic accident.
Yes.
It's one of the leading cause of death that you see. In Thai Health Promotion, we found that it's very important thing that Thai Health to focus it. We got a plan, the road safety management plan.
Okay.
Yes. According to the ADB and ASEAN reported that on March 2004, the average of economic cost of one traffic accident is about 2.8 million.
For one accident?
Yes.
That's quite a large
2.81 million baht. In addition, this also is inestimable.
Of course.
Psychology change.
Yes.
Right. Cabinet solution on 29 of July 2003 instructed that Thai Health could support this measure for a measure to improve road safety standards.
I see.
And in Thailand. Since that, Thai Health has been giving support to research projects and on prevention of road accident, including research on model model province is very important.
I
Yes,
see.
yes.
So you've been working on the road management safety after like 2003 when the cabinet came out with a resolution that they want you to help with this problem.
Yes.
I see. So you mentioned earlier that you have a road safety management plan as well, well, from the Thai Health Promotion Foundation. Can you explain to us about this plan?
Yes, the plan we have a 4 issue.
Okay.
Yes, one is policy improvement and created a common goals.
I see.
Yes, the second is networking is very important. Networking to empowerment and public relation campaigns.
Of course, yes.
And the third is improve of structural and integration of prevention on provincial level.
Okay.
Yes, for road accident. And the fourth is very important. You see, information and data system improvement, because the data and information very important for
Yes.
traffic accident. And knowledge management for road accident.
I see. So these are the key points for
Yes.
this plan.
Yes.
So it is implemented by the foundation
Yes.
into different campaigns, or it's just a major idea that you have to follow?
Yes, right.
I see. So I've heard that you also implemented on a different approach, which is called the triangle that moved a mountain, which is a very interesting name
Yes,
indeed.
yes.
Can you explain to us? Maybe some of our viewers wouldn't understand what this means.
Yes, it's very famous for Thai health employee
Yes.
or many other network that could be work with Thai health. And Thai health has employed and a concept this we call triangle that you said
Yes.
to move the mountain as the key strategy to solve.
Okay.
It's because it's difficult social problems. It have to be have a three power.
I
You
see.
see, the first one is to create the simultaneous strengthening capability
I see.
in three integrated section. First one is creation of the knowledge, the knowledge through the research.
Okay.
The second is social movement. It's very important. And the last is political involvement, because Thai health could work with the government sector or private sector.
I see.
Yes.
So by putting all this three together,
Yes.
what does it make? What kind of campaign does it do?
The campaign is could be have for the health improvement, and we call that maybe have many activities to do, such as the capability building for key personnel.
Okay.
It's very, I think it's very important because they have a lot of things just like a law, just
Yeah, of
such as a
course.
law, a training focus on method of coordination, just like and the second one the support organization working on road safety,
I see.
and the third is media campaign. It's very important.
Yeah,
for-
raising awareness.
Yes, raising awareness of the people,
Yes.
Thai people. And the information center for road accident is that I said earlier is very important.
I see.
And the last but not least is knowledge management and creation.
I see.
Creation is very, very, very crucial because how we create, how to convince the people to raising their awareness. Because you see that traffic accident is very simple.
Yes.
They have familiar with the accident.
Yes.
Not panic, not stuff like that.
Yes. Especially motorcycles.
Yes,
Yes.
right. And the other activities, Thai Health will support the reviewer or case study. It's very important to give an example to show for the society to know
Yeah.
about it.
To learn from
To
other
learn.
mistakes,
Yes,
of
right.
course. So we take a quick break here, but when we come back, we'll talk more.
Yeah, thank you.
Welcome back to the program. We are still here with Ms. Tassani Silapabut, a committee member of the Plan Executive Committee under the Thai Health Promotion Foundation. Welcome back to the program. So we already talked about the roles and responsibility of the foundation. So now let's talk about the campaigns that the foundation are rolling out for road safety campaigns here. As we know that other organizations out there also prepare road safety campaigns for the people, especially during the festivities period. So how does your organization or the foundation itself does it differently from the other foundations or organizations out there?
Yes, normally campaign of road safety has been emphasis on the main issue that I talked earlier.
Yes.
And just like a ding don't drive, reduce speed and helmet campaign, and including the traffic behavior.
I see.
But for this year, Thai Health is look different things. We want to raise the awareness of the of people, of Thai people themselves, such as กลับบ้านปลอดภัย it mean go back home safely. Does it mean not to order them to do, but rise up their awareness.
I see.
How you go home safely. Why? No.
Make them think, basically.
Yes.
I see.
It's very important that because when they think by themselves, they could do the better thing.
Of course.
Yes.
It's better than telling them what to do.
Yes.
When you ask them something and when they have to actually think, it's more likely that they would, implement it on themselves.
Right, that you said.
I see. So what are the campaigns that are you doing right now that you're trying to raise awareness on this issue?
We have a theme or a singer to sing a song, country song, just like that. They have a movie, a short movie. You can take a look in soon.
I see.
The end of this month.
I see.
It's very beautiful. I heard it.
I see.
Yes.
So it's like media, out through media outlets, basically to raise awareness.
Yes.
But the foundation doesn't do road safety campaigns only during festivities, right? They also do it year round.
Yes.
So what other, campaigns do you do other than, Songkran festivities period?
Let me say back to the New Year. On the New Year festival has amount of traveling soul. We try to campaign drink don't drive, just like that, and helmet behavior. But Songkran festival, we deeply emphasize on drink don't drive because this problem has been fast increasing.
Yes.
And we get to know that through the year we have rise up the local communities, provincial,
I see.
to take to do by themselves and think about how to save their own area, just like that. Maybe we have a cooperation with the local communities. We have a call กองร้อยน้ำหวาน it mean the group of people, just like a mom, dad, who take care of their children.
I see.
To let maybe have the look after the boy, the children, just like that.
Okay, give them a sense of family, basically.
Right.
I see.
Right.
So how is this year's campaign different from the previous years?
It may be totally different because we want to get the people think about the self-reliance and self-concern about just like safety culture. Should they have more discipline of traffic safety?
I see.
It's very important.
Because I've noticed that in the previous year, it's more of like campaigning to wear your helmet, to drive slowly, or things like that.
To point out what they do, what
things
they
that they should do.
Yes.
But this year, it's a little bit different when you're actually reversing the role because you're questioning them instead.
Right.
I
You
see.
said it very correctly.
I see. So in this case, how was the feedback like from these campaigns? Can you give us some examples of the previous campaigns or campaigns earlier, such as the New Year's campaign? What was the feedback like?
It's very brilliant to admire of the campaign very much because the people that obey the regulation more than previous
Before.
time. Yes.
I see. And why do you think is that the reason?
Because maybe we could say that we touch them by closely to do how they behave of themselves
I see.
to more discipline in traffic safety.
I see. I see. So in this case, as we're already talking about Songkran, it's coming up. So what about after that? Is there other campaigns that are you planning to promote after Songkran for road safety campaigns?
Yes, for this Songkran, we have a campaign that we said that safe back home.
Yes.
And how they back home safely, such as drink, don't die, no speed driving, maybe prepare themselves before traveling to their homes, just like that. And Thai people could be reminded that this campaign will be self-prevention.
Okay.
Yes, but all of this depend on their behavior. On our campaign can be stimulate their partner. The partner organization could be cooperate with Thai Health.
I see.
And have their own campaign. They think by themselves and do by themselves.
I see. So it raises awareness not only to the public but also to other organizations as well.
Right,
I see. So we take another quick break here, but when we come back we will talk more.
Yes.
Welcome back to the program. We are still here with Ms. Tassani Silapabut, committee member of the Plan Executive Committee under the Thai Health Promotion Foundation. Welcome back to our last break here. So earlier we already talked about the campaigns that you are preparing for Songkran Festival. So what other campaigns are the foundation is working on for road safety?
We are focused on not only the campaign, but we focus on the implementation.
I see.
And by supporting, and in the provincial level.
I see.
Yes, district level and also local areas. We are supporting them to be a key person to manage.
I see.
And solve the problem on road safety by themselves.
Okay, so you're trying to create self-reliance other
That's
than
right.
telling them what to do, but
Yes.
make them realize what is important basically.
Yes.
Actually, it's a very good strategy because people wouldn't listen when you tell them to do something. They like to realize it themselves. Exactly.
Yes, right.
So I've heard that the foundation also partners with international organizations as well. So can you tell us a little bit more about that?
It's fortunately that we have a Thai Health Promotion Foundation, have the closely collaboration with Sephiroth Foundation in UK, London.
Okay.
Yes, by Mr. Michael Woodford.
I see.
He's executive chairman of Sephiroth Foundation. We call SIF.
Okay.
And SIF give the donation for many provinces that we implement the area.
I see.
It's very effective when we have a cooperation with Sephiroth Foundation, such as in Khon Kaen province, Chiang Mai, Phuket. Three provinces could be
major provinces.
Yes,
basically.
major provinces. Is the center of the economic in the provincial areas of Thailand, and they have a lot of statistics. It's very high. Accident statistics is very high, and very effective. I could mention that in Khon Kaen we have a collaboration with Sephiroth and other public sector, private sector. Even that they got some money too, and many stakeholders could share their resource to top up.
I see.
It's very fantastic.
I see.
Thing
So how long has it been ongoing, this partnership with the international organization?
Just for 3 years.
Okay.
3 years.
And how is the feedback like after they've been partnered with you?
I could give you an example.
Sure.
The road number 118 in Chiang Mai. We call Chiang Mai and Doi Saket. Chiang Mai Doi Saket is the road from Chiang Mai to Chiang Rai. You have heard
a lot of corners.
Yes,
I've heard about that.
Yes, many sharp curve, and they have mass casualty
Yes,
of the
a lot,
accident,
a lot of
around
accidents.
maybe death toll is an enormous number.
Yes.
Yes, and then after implement the speed camera that several bring the money to the Chiang Mai team, road safety team, and now the implementation cooperation with the local administration,
I see.
the governors of Chiang Mai, the policemen from the Doi Saket station, just like that. It's very effective.
I see. That's good to
Results.
hear. That's
Yes.
very good to hear because
Yes.
I've heard that there's a lot of accidents and
Yes.
a lot of people are even scared to drive through the road if
Yes.
they don't really know the
Yes.
area.
Also in Phuket, you see,
see.
the Phuket is a very tourism
Yes. Yes.
attraction place that many foreigner or Thai people go there.
Exactly.
As have the several foundation give the breath numberizer.
For alcohol
for
check.
alcohol check and many to improve the dangerous section to the roundabout and have many things to do a lot
I
in
see.
there.
I see.
And now that you have a result
Yes.
for after implementation is very good result.
I see.
Yes.
It's definitely a very good thing to hear. Once you
Yes.
know, if you could save lives, it's always a positive thing.
Right.
So in this case, the Thai Health Promotion Foundation here doesn't only do road safety campaigns,
Yes.
right? I know that they also you do a lot of different campaigns as well.
Yes.
So can you give us some examples or tell us about other campaigns?
Yes, Thai Health Promotion Foundation have 15 major plan that to do a lot of the campaign, just like the major risk factor, just like from the tobacco and alcohol,
I see.
and maybe the health oriented, that lifestyle, just like that.
I
have
see.
many plans to do.
I see. So your campaigns are more focused on, healthy lifestyle and health consciousness, basically.
Right,
I see.
right.
To let the public have, a healthier lifestyle.
Yes, and we Thai Health look more many group of people, just like special group for aging people,
Okay.
For Hill Tribe, for the handicapped person. We will take a look after of that
I
group of
see.
people.
I see. So you have to each campaigns cater to different group of people.
Yes, yes.
So can
even the children just
I
to
see.
and youth too.
I see. So can you give some examples, like some ideas of what type of campaigns that you do?
We have ออกกำลังกาย we call in Thai ลด
Reduce
พุง
the belly.
reduce the obesity.
Yeah.
Yes, like
I
and
see.
We have a campaign just like in the children, just like to prevent them from the drowning in the summer season.
Yes.
Just like the children like to
Swim.
Yes,
I
like just
see.
like
Yeah,
that.
because they have a lot of casualties when
Yes.
kids they're hot, they want to
Right.
have fun, and
Right,
then they
right.
just drown.
Yes.
I see. So, lastly, as we have limited time here, would you like to say a few words to our viewers?
It's mean that we Thai people should be understand that the road safety issue is their problem, and it means that they should keep the traffic discipline, and they can take their behavior to do the good to realize that
Yes.
you don't face for the risk factor. Don't speeding, don't drink, don't drive, just like that. Or maybe wear the helmet for the motorcycle. And the top 10 of the road traffic accident will be deleted if all the partner or Thai citizen realize and understood and seriously implementation.
Yes, I think that's very important. That
Yes.
I think everyone knows what to do, but the problem is, do you actually follow the rules or not? So that is a very good advice indeed.
Yeah.
Well, unfortunately, that's all the time we have. Thank you so much for joining us and sharing with us the information.
Thank you so
ขอบคุณค่ะ
much. You're welcome. Yes.
Despite the overall improvement over the past years, there are still challenges that Thailand and the Thai government still have to overcome. even though that the awareness is already raised among the public, but it still remains that the youth and the people and other organizations still needs to be more involved and also help in this raising awareness of this campaign. Hopefully, the ranking of Thailand will improve and will improve in the long run. And that's all the time we have for this episode. Thank you for tuning in. See you again next time. สวัสดีค่ะ